All right, I think we have everyone. Good evening to everyone. Hopefully everyone is doing well. And welcome to week 9. As I mentioned in week 4, that it goes by really, really fast after you take that first exam. And so here we are, finishing everything up. So as usual, place your name and campus in the chat. Ensure that your name appears as it appears on the roster. In the event that you're having connectivity issues or any other issue, please place a message in the chat to myself. Do not send it out to everyone. All right, so let's look and see what do we have left. Let's see. Let me share my screen here. So we put an overview in the announcement on Sunday so that you can kind of just go ahead and be, again, thinking about what's required of you, home, work, family, school, all of that. So you can start just thinking it through, putting things on pause, maybe rearranging things, whatever it is that you need to do. And then also keep in mind, if, for those of you that are taking more than one class, week 10 is another one of those weeks, as I mentioned early on in the term, that's when you more than likely will have both of those exams. And also for week 11, remember that your HESIs usually are not given during this time of night. And remember, this class is offered Monday through Friday. So your HESI may be offered on a Friday. So make sure that you are getting the information from your campus dean regarding when your HESI is. And it is specific by campus. So one HESI, all HESIs on the same day, it doesn't work like that. So make sure that you're getting the information based on your campus. So we're in week 9. We finish up our content. The HESI prep assignment is due on Sunday. And also remember, it was an assignment, but it also was prepping you for the HESI. You were supposed to address each concept using Apr to guide you. And therefore, if some concepts Apr, one of these letters did not apply to, that's fine. But using Apr keeps you structured and helps you think the forward, the backwards, the positive, the negative, no matter how you see that topic in clinical or on the NCLEX or on HESI. Using this format will help you. And remember, ABCs trumps anything. Okay? And so, of course, we finish our content. Be sure to turn in your NCLEX questions. Turn in that highest score. Because remember, every point matters. All right. So we have the live exam review sessions. I've posted the links that are available. So make sure you check out that in the announcement section. So next week, of course, we'll be taking exam 3. If you need that exam proctored or any of your exams proctored on campus, remember that 72-hour notice that you must give. And that's so that a person, a place, can be found, and so that you can take that exam, in an exam setting. So we need someone to proctor that exam, and they need a place for you to be able to take that exam without distractions. So send that email to your campus dean, include Dean Brown, include myself in the email as well, because your campus dean is who sets that up. In the event that's something that you need. HESI exam reviews, that schedule is out as well. We can look at that here in a few. If you cannot attend any of these exam reviews, whether or not it's HESI or the exam, please commit to at least going back and looking at those recordings. In addition to those recordings, go back and listen to your classroom recordings. For any concept that is still unclear, send an email or a text message or a phone call so that we can talk through that concept. So week 11, as I mentioned earlier, is week of HESIs. It's campus specific, and generally the classes that are later in the night, like this one is, HESIs are generally not given this time of night. So just think about your schedule. You may have to alter some things in order to, be prepared and take that exam. So week 11, we do not meet. Your HESI counts as your attendance for that week. So the Zoom will not be open because we'll look in and see if we give you that week. Because sometimes, even though it's a Wednesday class, HESIs are not taken till Friday. And so that count, no matter what day your HESI falls on, it counts as your attendance. So for week 11, you do not log in. In week 12, for right now, we will log in. We'll let you know more closer to that date, because most campuses usually close on that Wednesday by noon. So if there is some type of alternate schedule that's needed, I'll let you know. So that you can, because they do want us to still do attendance for week 12. All right. And so we have a case study that we'll look at. Let me go back to the announcements here and show you the schedule here. So there are 2 links in here. And that's what we have so far. But make sure that you are going back, looking at our classroom recordings as well. HESI information updates. I already have some information here. Okay, so you want to look at this updated live exam review schedule here. Let's see what it says. So exam 3, today's the 4th. So Professor Marvel has hers on Friday. My link is posted already. Professor Turney will have hers on Saturday. This is for exam 3. And Professor Foster already posted too, because there are 2 already posted. And this one will occur today. So hopefully we'll get that. So it just occurred not too long ago. So then also what's on here are the HESI review dates as well. Excuse me, review dates and times. So just make sure that you're looking at that. All right, let's see. Can I get back here? Let's see, announcements. I think that is it. Yep, that's it for now. All right. So are there any questions about those exam reviews or HESIs and HESI preps? And for HESI prep, in addition to that, go back to week 1 and 2. Make sure that you're looking at those classroom recordings as well, because the HESI, we don't know any of those concepts on that assignment could be on the HESI. So make sure that you're going back looking at that. It's just not, the last couple of weeks. It is the entire term. Okay, are there any? All right, so we'll move on, and we will make sure we cover we're going to cover our new content as well as our old content. So I'll stop and ask some questions away, and we'll do some Kahoots just to make sure we have covered everything and we're ready to go for next week. All right, so share my screen here. First, let's do we're going to do a Kahoot, but we're going to do the learn, and then you all as what I need to mark. So it is loading, and I'll share my screen here in just a moment. Okay, so I need you to tell me what to mark, and I'll mark what the majority actually say. So this one says open lesions and inflamed tissue decrease HIV infection and other infections. This is true or false? Okay. And look at test taking tip. Excuse me, you all. Look for those words that will change what you were traditionally thought about a term or a concept. And so make sure that you're reading the entire scenario through, and words like decrease, increase, and all, just be mindful of those words. Okay. The HPV vaccine requires a minimum of 3 doses, must have 3 doses of the vaccine.
True. It depends the age.
True.
Okay. So that's 3 doses. So if a person were to say, I must get a minimum of 5 doses, does that person need to be re-educated, or that information is true?
Re-education.
Okay. So again, look for those questions. If it asks, because the person that a minimum of 5 doses, is that correct or incorrect?
Incorrect.
Incorrect.
Incorrect. So if I need to be retaught, that means the patient or the statement that you're reading is incorrect about the concept. Test taking tip. Make sure that you're thinking that through when it says a person that needs to be retaught. But if they say the person education was successful, or what's another word that they use? Education is I forget the word they use. We're gonna just say successful because it escapes me right now. Would that person's statement be something that's true or false? If education, the information that was taught, we reinforce the information, was successful. Is what they're saying true or false?
True.
True.
Good, got it. You all got it. Good. All right. So this is talking about the HPV vaccine can be given as early as 9 years of age.
Yes.
Yes.
Okay. Okay, this is a person stating, I am relieved that the vaccine protects me from all HPV infections.
False.
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 What word makes this false?
All.
All.
You're
Oh,
not totally full
All
protection
HPV.
to
All.
any virus. It's just
Okay.
a prevention.
Got it. So all makes this incorrect. It's just like the flu vaccine. I got the flu vaccine and I ended up with the flu. Yes, you possibly can because it does not protect against all. Good. Okay. All right. I'm relieved. This person is stating, I am relieved that the HPV vaccine protects me from most HPV infections.
True.
Yes.
True.
Okay. So it really was the same as what we just, but that one word changed it. So good. Okay. Regular pap smears are still recommended despite being vaccinated for HPV.
True.
Yes.
Okay. I hear yeses and trues. Okay.
True.
All right. Hepatitis B infection cannot be prevented by immunization.
False.
False.
Okay. HIV test that came back negative is valid with a recent exposure.
False.
False.
Why would this be false? What's your thought process?
You have to retest after
At 3 months.
3 months.
Or 12 weeks. Got it.
Or 12 weeks.
Got it. Okay. Primary stage of syphilis is indicated by a positive serology or blood test.
True, I think. Let me see. Primary stage of syphilis indicated by
I heard one true. We're going with true.
True.
Why is this incorrect?
Is it because it's not a blood test?
Or because it's a positive?
Because it's the
Primary
primary stage. Primary stage, we're seeing signs and symptoms. To move on to that next stage, we do that secondary stage is when they do the blood test or the serology. So if you see serology, that's nothing but a blood test. So that stage is what made it incorrect. Okay. So primary stage of syphilis is indicated by cankerous sores, places on the body part.
Now I'm confused.
No,
I'm
no
gonna say
primary stage. Because
it's
showing
primary. I
already.
would say it is primary because
In
the other
even
one was
primary,
blood work, which was
primary
after, so.
has to be false.
All right.
I think it's not false. Because it's not a primary, the symptoms. That's already.
So put it in the chat. Let everybody put it in the chat. Put a T or F, and I'm gonna go with what the most say. Put a T or F in the chat. So this right here says primary stage is indicated by signs and symptoms. That's what this is saying. Put it in the chat. Let me see what you got in the chat. Primary stage. Okay. See a bunch of T's. So I'm gonna go with the T. Let's see. That is correct because it's the primary stage. Remember, we just said this right here was false because the primary stage is indicated by positive serology. That is in correct primary stage of the signs and symptoms. This would be the secondary stage where we do the blood test. Uh-oh. I think that I just give the next answer. Let's see. Secondary stage is indicated by a positive blood test or serology.
True.
True.
Okay. Yeah, usually if they're trying to see if that disease process has gotten better or worse, they go ahead and draw blood. Then initially they just go on the signs and symptoms. All right. I'm not going to read this one. Tell me what I need to mark.
B. I'm sorry, blue.
That our final answer?
Blue.
Blue.
Why
Yeah.
was it not red? Let's go back. Why was it not red? It's not going to let me go back. Why was it not red?
Because it's not antibiotic,
Because
it's
the
antiviral.
herpes simplex
It is a
is not
virus.
go away with
It's a virus. Exactly.
It's
So
a virus.
viruses are treated with antivirals. Infections are treated with antibiotics. Got it. Okay. So let's see here. Did pretty good with that one. So let me just ask you some questions here. So what's that single thing that single most thing that we can do to prevent the spread of infection? Everybody can help with this one.
Hand washing.
Hand washing.
Hand washing. So yes, we do know that they have the alcohol-based gel. And so make sure that that percentage, and I want to say, is it 70%? That it must be at least 70% in order to be effective. There are some hand sanitizers out there that do not have that correct, that amount of alcohol in it. But no matter what, if you have soap and water, we need to be washing our hands with the appropriate time. So let's talk about some precautions. Usually, if someone is on airborne precautions, what disease process is we're most familiar with someone might have?
Tuberculosis.
Tuberculosis. Okay, so tell me about the room. Are they staying in the room with someone, or do we try to get a private room?
Private.
Private room. Isolation is possible.
Okay, and so what about if that patient has just want to go out to leave their room to go to activities or to the dining hall?
No.
I don't think it's
They don't leave their room.
they should. It's not. They're gonna spread.
Okay, so yes, they're only leaving their room for very important things. Now there are some tests and procedures that can't be done at the bedside, and there are a lot of tests now. They've improved things, and they can just come to the bedside, but some they cannot. And so when that person goes out, they're wearing a mask. So when we go into that room or visitors enter that room, what type of mask should we be wearing?
N95.
N95 PPE. You know,
Yeah.
the
And
gown.
it's also called what? What's that N95 also called?
What's a respirator?
Yes, a particulate filter respirator. Yes, I think everyone knows what an N95 is now. And so since COVID, but yeah, it's called a N95 particulate filter respirator, and it's worn by anyone that's going to enter that room if the patient has primary tuberculosis. A private room is preferred, like you said. And of course, we're going to put on our other PPE. We just want to make sure that you do understand that there's a different type mask that we're going to put on when we go in that room. And then the patient should only leave that room for those essential activities. No, if they just want to go to the dining hall or to activities, nope. Essential activities only. So what about, our patients, they're in the hospital, or even if they're in the long-term care facility, a lot of times they're in there for rehab. They go home, but sometimes their wounds aren't healed. So once they get home, they still have to do the dressing changes. Give me instructions for disposal of those soil dressings. What would you reinforce? What would you say as the nurse to that patient that's going home and they're having to do dressing changes? What should they do? How should they dispose of that soil dressing?
Maybe put it in a plastic bag, tie it up, and then throw it into the garbage can.
Okay, so that lessens the contact of someone coming in contact with those soil dressings. Of course, you're at the hospital and the long-term care facilities, we have all these different containers. At home, they don't have all those different containers. So what can we do? What information can we give so that that person, others in the home, will lessen the contact of coming in contact with those soil dressings? And you all are correct. Place those soil dressings in a bag, tie that bag up securely, then place that bag inside of the garbage can. Okay, so where would we look? For the most part, all states have reportable diseases. Now, there are a few that are not reportable in some states, but that are in other states. But nevertheless, each state has reportable diseases. Now, where can we go to look to see? To find out if we're in Florida, if we're in Alabama, if we're in Ohio, to see if the patient's disease process that they have that we're taking care of, if we need to report this. What can we quickly look?
At the
Center of
CDC.
Disease.
Department of Health.
Okay. So I heard the CDC and Department of Health. So which one we gonna go with?
I would say CDC.
Remember, it's state specific.
Department of Health.
Yes, so the Department of Public Health, that state's health department's website is going to have it easily. They're going to have that little button there. So requirements for disease reporting in the United States are mandated by state rather than federal law. So the list of reportable diseases, they vary by state. State health departments, that is who we're going to report. We're going to look for that information. So it's nothing you have to commit to memory. It's on their website. It's on that website so that we can follow whatever it is that they tell us to follow. Sometimes there are forms that we have to fill out. There are interviews that we have to do. It just depends on what the disease process is. So the CDC, they update conditions annually, and this list can be found under the heading Nationally Notifiable Infectious Diseases. But if we're looking for the latest information for that state, we're going to go to that state's health department's website to find it. So they have a button that's specific for that. Okay. All righty. Any questions about infectious diseases? Okay. All right. So let's move on to our next topic. So we pretty much covered these in that Kahoot that we just did, but we'll just go back over those concepts just to make sure that we have them all. So usually what is a blood test is also called what? Begins with an S.
Is it
Serology?
serology?
Serology. Which stage of a disease process is a serology or blood test usually done? Primary or secondary?
Secondary.
There.
Okay. So yes, a positive serology will appear if that disease process has moved on to that secondary stage. And usually, like I say, initially they'll just go in, they just go based on the signs and symptoms, the subjective and objective information. But they want to see if that disease process has gotten worse, if treatment has helped or not, then they'll go ahead and draw the blood, the serum. So, and if it's positive, that means that disease process has moved on to the secondary stage. Okay. All right. So I'm going to give you some statements, and I need you to tell me whether or not the client, we got the patient in room 201, whether or not they need additional education. We have the patient in room 201, and we're trying to determine, we're in there talking to them, and we're trying to determine whether or not that patient needs additional information. Okay, so if the patient needs additional information, more than likely they are saying something that's correct or incorrect, true or false.
True, because you said correct or incorrect, right? That's what you said?
So which one? Some people like to use the words incorrect or correct. Some people like to use the words true or false. So if the patient in 201 needs additional education, the education needs to be reinforced again. More than likely, the information that they're telling you Is it correct or incorrect? Or true or
Incorrect.
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 okay? Because if the things that the patient is stating in room 201 is correct, that person doesn't need any additional or that information that need to be reinforced. Okay, so let's just do some. So the patient in 201 states, I got the flu shot, but I can still end up with the flu.
That's
Would that
true.
True.
That's true.
okay, so that person does not need additional education. Okay. What if the patient said, I got the HPV vaccination, so I'm protected against all HPV infections.
Need additional.
That's false.
Okay, they need additional. All right. All right. And so, what was that immunization that, for the most part, if you're a healthcare professional, that most of them get? There's a 3 series.
Herpes zoster. HPV vaccine.
What was the name of that immunization that us as healthcare professionals, most of the time, unless there are, some contraindications or other reasons, most healthcare professionals have received this
Is
immunization
it Hep B?
to prevent hepatitis B. Remember, is that 3 series? You get the injection, the immunization, and you go back. I want to say it's 30 days, then you go back in 3 months, and then every so often you have to get a titer. So the hepatitis B infection can be prevented by immunization. Hepatitis B. Okay, we talked about the HIV antibodies not showing up within that prior to 3 months or 12 weeks. So you all did answer correctly on that. You do with the infectious diseases and STDs. We do want to be careful that that the mom is treated, because especially that mom is pregnant, because it can be, a lot of those diseases can be transmitted to the baby. And so that treatment is very important to prevent complications to that child. So we want to make sure that we're reinforcing that information. All righty. I think that's it for that topic there. Let's see here. Let's do another Kahoot, and then we have bioterrorism, we have home care. We have some more sections left, about 5 more sections left. Well, no, let's go ahead and talk about cultural influences. Let's talk about those. Okay. So is it important to know any restrictions that your patient might have, if they, that they might have, no matter if they're Muslim, Jewish, it doesn't matter. Is it important to know if they have any food restrictions or any restrictions altogether regarding their care? Is that important?
Yes.
To get the proper care.
Exactly. And so we do want to find out, about our patients, the things that, that their cultural beliefs, because that's part of their care. It helps us to take care of them, provide that best care. In the event that treatment options are, not an option for them, it helps us to know that, okay, this client does not just want to be non-compliant. We need to seek out other solutions, because if it's against their culture or religious belief, we need to be seeking out other options for them. And in the cultural beliefs can include food. Muslim and Jewish followers require food to be prepared according to their religious law. And so in the Jewish faith, it is called kosher, which also requires the separation of milk and meat. So again, it is important, no matter how simple or like, well, it's just a dish of food. No, that's just as important as other interventions, because all of that, you're taking care of that whole person. So we do need to know that Muslim and Jewish followers require their food to be prepared according to that religious law. And then if it's not, then, they can't partake in it. So we need to seek out that information, because we do not want our patients to eat. We do want them to receive the nutritious meals. Now, when we're working in the community, it is so important to identify those trusted community leaders. No matter if we are, we just have something we just want our community members to know. So we just want to do a radio announcement. We just want to pass out flyers. It's still very important to find out who those trusted community leaders are. They're kind of like gatekeepers, because if they don't put their stamp of approval on whatever that intervention is that we're trying to come in and implement, then it will not be well received. So identifying that trusted community leader, and a lot of times it's the person of faith, it could be the PTO president. There's no one person, one title that a person will have to be that trusted community leader. But we need to know that identifying that trusted community leader helps us to discuss the things that are accepted in that area, and to identify the barriers. And so if we have information for a patient, okay, we have the patient in room 201 and they speak German, and we have our literature, we have a radio announcement, we have a flyer, we have a newspaper article, and it's written in Spanish. Is that going to help our patient in 201?
No.
No.
Okay. So what do we need to do for any of our patients that speak English, Spanish, whatever it is, whatever language they speak? What do we need to do with that information we're wanting them to know about?
Make sure it's in their language.
Good. Mm-hmm. Go ahead. Sorry.
Make sure it's in their language, whatever that target language is. Because if I speak German and you're giving me something in English, or you're giving me something in something other than German, then it's just some information you're giving me. I don't understand it. And so I am least likely to, first of all, I don't know what it is, can't understand it. And then what do I do with the information? I don't know what it is. So it's just some information that we're giving out. So we need to make sure that information is in that person's target language, their key language, their main language, their first language. All those mean the same thing. Okay, we talked about the community leaders. I think that's it for the cultural beliefs, being culturally competent. Any questions about cultural influences in nursing? Any questions about that? Let me get this other Kahoot pulled up while you're thinking if you have any questions. Let's see. Okay, let's look at bioterrorism. So we're gonna do the Kahoot a different way. Go to actually in. So at a minimum, I'm gonna share my screen here. It's trying to load. Usually this phone to load. Let me refresh because it still hasn't loaded. We might have to let's see the flashcards. Let's see what flashcards is. Let's see if that mode will load.
Yeah.
Yes.
Okay, so I'm not sure what's going on with the Kahoot, so let me just talk. We'll just talk through it again. We'll just lecture. All right, so it says proper management for a client that has been exposed to toxic chemical spill. So what is the concept? Proper management. Then it says that the person has been exposed to toxic chemical spill. So you all tell me some things that we should do regarding the clothing. How should we be handling the clothing? Okay. Boil and then hot water heaters. The tank of it, boil, add bleach. So yes, we can boil that water for that 3 to 5 minutes. We can pour that, was it 16 drops, which is 1 cc of bleach into that water and let it stand. And then we can get that water out of the hot water heater or that tank. Because if you think about it, I know it doesn't sound good, but it's just sitting there. That water hasn't been used in that hot water heater or that tank. It's just sitting there. So we really can't. And this is just, in the event that there's some type of disruption. So we want to drain that water from those hot water heaters. Add that 1 cc or 16 drops of household bleach to that water, to a gallon of water. And then we let that water sit for 30 minutes. And then we can boil it. We can boil that water. So I don't know if you all have been in any of the facilities when they have done like these mock drills or they've done fire drills. Have you all ever been in the facility doing clinicals, or at your, if you are in a healthcare facility when they do those mock drills? So is there like a leader or someone that kind of gives those firm instructions as what to do, or does everybody just go about and just do their own thing? How does it, what happens?
No, someone gives the instructions.
They give you a training with a guidance how to do in an emergency, where to go, where to get the emergency, what the exits are, the safely way to go out.
Okay. So yes, there's that person on that shift. Every shift, someone's identified as that leader. In the event that something happens, that person is going to, of course, recognize that, something's going on and we need to respond. And so that person clearly gives instructions about, moving, transferring our residents, who to call if we need to be notifying the health department, the fire department, the police department, and all of that. And that is called the impact stage. So something has happened. So whether that is a fire or I know they're doing a lot of those is it natural disaster drills now? So they're doing a lot of that. But there's always going to be like that 1 or 2 persons that's kind of like leading and guiding and reminding everyone, okay, hey, and it might be you, especially if you're that that charge nurse for that night or that shift. And you just never know when something will happen. Someone forgot to clean off the vent of the dryer. That lint, it can spark fire. Equipment malfunctions. You just never know. So just make sure that wherever you go, that you're reading and understanding what should be done in the event that, something happens. Because we need people to respond so that everyone, the patients, the residents, the clients, whatever setting you're in, whatever you call them, and also you, that you're safe. So make sure that you're understanding what you should do. Now, bioterrorism, a lot of times they use those agents like sarin, and usually those biological agents, they attack that respiratory system. So we need to be thinking about all things respiratory, like counting respirations, listening to those lung sounds, assessing and measuring that O2 saturation. Are we going to administer breathing treatments? Is this person going to need to be on mechanical ventilation? All things respiratory, because it's just how those chemicals are made up. They attack that respiratory system. So, and I did say mechanical ventilation, botulism, sarin, there's another, but all of those biological weapons, that's what it usually attacks. So all hands on deck, respiratory. Okay. Let me see, can I get this little thing to play? Mm. No, it's still okay. Wait a minute, it's moving now. So let's see. Let's validate what we just talked about. Okay, let me share my screen, and in the middle, just put your initials on there so we can look started. I won't lose you all for the Zoom. Okay, here we go. All right. And let's get started. Here we go. Okay. So remember that the chicken pox vesicles, they're not found on the soles of the hand and the palms of the feet. So usually the chicken pox vesicles and the smallpox vesicles are the ones that we have to be reminded. Smallpox only occurs on the palms of the hands and in the soles of the feet. Okay. So water cannot be rendered safe for drinking by doing this. So we can put the 16 drops of bleach and let it sit. But this right here, pouring that water through layers of cotton towels does not filter out to make those that water safe. It does not. Because remember, that water is just sitting in those containers. That water has not been used yet. So yes, we can. Okay, it takes up to that 3-month or that 12-week period. So is this a standard intervention? So someone comes in for STD testing. Are they counseled about risk of activities, risk reduction activities before and after the test is done? Yes. Good. If I can write along. So all those slides were saying the same thing, just it was paraphrased. So good. You didn't get tripped up on that. It's good. Okay. Medical asepsis principles for in the home. Patient has left the healthcare facility, but they're on contact precautions. Okay. No, we want them to do hand hygiene more than when they think about it. We should be purposeful when we're doing hand hygiene. Before and after, doing dressing changes, before handling food, we want to be purposeful about hand hygiene on purpose. Okay. Okay. So by now, everyone knows what an N95 is. They may not know what that particulate filter mask is, but N95, we're most familiar. So the patient is on airborne precautions, should leave the room whenever they would like, even if it's with a mask. So that's false. Even if they have a mask on, they don't just leave. It's only when necessary. Got it. Good. Okay, so this right here, the standard precautions automatically fall in here. So you could have selected both, or if you just selected airborne, it still was fine. But because we know standard precautions is going to be used anyways. But good, good. Almost there. Healthcare associated infections. So this person was receiving healthcare. They got an infection. Oh, I'm telling the answer. I'm sorry. But that's how when you read a scenario, you're thinking like, okay, what is this question asking? What's going on? So yes. This one, the words actually tell you what it is. Healthcare, they were receiving healthcare and they, got an infection. prevention of healthcare associated infections are? What are some things that we can do to prevent it? Okay. Wash your hands. Using those environmental infection control measures. There are specific things that the environmental department, they come in and do, wiping off those surfaces. And of course, we're going to use our PPE. And our infections that patients get out and about. In some answer choices, they make absolutely no connection, and those are placeholders. So don't, if it's not in your knowledge bank, don't try to make it be something that you have not learned. Okay, when there are airborne precautions, a patient should leave the room only for essential activities with a mask. When there are airborne precautions, a private room is preferred. I mean, that person's in the room by themselves. Now they semi-private. Yeah, almost there. Proper management for a client that has been exposed to a toxic chemical spill. Okay. The sharing of information from one healthcare setting or provider to another important. So if the patient is leaving the hospital, going to home, so and the patient is receiving home health, or if the patient is leaving the hospital and going to a long-term care facility, should those healthcare professionals in those different settings, is it important for them to communicate and share information? Yes, it is. Because remember, they identify, it's just like giving a report. We're going home and the next person's coming on. It's just in a different setting. So it is important that we share information. A person is just not discharged from the hospital and go home and receive home health care and no one has taught. That should not happen. Okay, community-based care communication is acute care and home health agency staff. Oh, this is an example of community-based care communication. Is this an example? With the acute care, meaning the hospital, that's acute care, they're talking to the home health agency, or the hospital staff is talking to the skilled nursing facility. Okay, got it? I think that was our last one. All right. Let's look and see what else do we have. So any questions about any of those concepts so far? Let's look at some other major topics. Let's look at care of complex illnesses in the community. So we have a unlicensed personnel, or they could be a CNA, they have different headings. Would we assign them a client that is unstable, even if it's a task that they can complete?
No.
Okay. So what is important? If a person, they don't really want area rugs, I like them, but what's something that we need to ensure when we're trying to prevent a fall and injury? What's something that we need to add to that area rug if a person is going to use an area rug?
Like
It needs to be secured to
security.
like the taping underneath.
Okay, that taping is called a non-slip pad. Some type of non-slipping something mechanism, like they have like these little thin wafer things. They even have like this little tape thing, but the whole idea is a non-slid pad, because I don't know if you walk on that area rug or that throw rug, they call different things, in that perfect spot, you go flying through the air because it moves. And so that the idea is that something that makes that area rug not to move, that makes it stay in place, we do want to use that. Okay. So true or false? We're delegating to a unlicensed personnel. Do we want to list information that needs to be reported back to us? Is that important?
Yes.
Okay, so we're giving them a task. Is it important that we give instructions on how that task should be completed?
Yes.
Yes.
What's to be done, when it's to be done, is that important?
Yes.
Even though we've delegated, the nurse has delegated, are we relieved of our responsibility?
No.
No.
Okay, great. You all are rocking. Let's see what else. So we kind of mentioned PAD, peripheral artery disease. That's where those vessels are small, and so that blood has problems with flowing like it should. What's something that we want to teach our clients to avoid or not to do, or if they do this, they need to stop doing this because it's going to smoking, because it's going to further make those vessels even smaller. Therefore, the blood will have an even harder time trying to go through those vessels. So smoking cessation is critical in improving circulation and actually managing peripheral artery disease. What's some other things do you think we need to educate our patients on if they have peripheral artery disease? So the person has a problem with circulation. Is there anything they need to be looking at or inspecting? So we're talking about they have poor circulation.
The calves.
So looking at, of course, those legs and feet for any injury or any sore. So they need to be looking at them. That whole leg, including the foot. Because if we're at peripheral artery disease, that's where a person has problems. The circulation is not occurring like it should, then that person's at an increased risk for sores, or if they have one, that those sores do not heal. So we want them to make sure that they're looking at the legs and the feet and all of that daily. It's almost just like the diabetic that's supposed to inspect their feet every night. We want someone that has peripheral artery disease, they need to be inspecting and looking at those feet as well. We do want them to avoid or stop smoking altogether. And then, they said regular exercise is good for everybody, no matter what it is, for whatever the disease process is. So we want to encourage that that exercise. So the patient care partnership, I don't think we talked about that in here, but we want to include our patients in the care that they're receiving. It's important that we find out their cultural beliefs. It's important that we know how much they know about their disease process, because it could be not that they're trying to be non-compliant. They might not just understand what that disease process is. And so in addition to that, we do want to identify if they have any preferences. Do they have any goals that they would like to set for themselves? And then that makes that patient have more buy-in, and they're more apt to comply with the interventions. And then even if it's something that they don't want to do, they're more apt to tell you about it, to have a conversation about it, because we have included them in the care that they're going to receive. So we do want to make sure that we include them in there. Like I say, it's that partnership. Now, if a patient what's the minimum time that we turn and reposition a patient? We turn and reposition at a minimum every how often?
Every two
Every 2 hours.
hours.
2 hours. Okay, that's a person that doesn't even have any skin damage. So let's talk about a person that might have a reddened area and that does not blanch. So that's like that stage 1. There's no open area yet, but there's that red area and we're touching, we press and we release, and that area does not blanch. So that open area isn't there. So what can we do to that skin to create like a perfect condition for it so that skin can heal? Because that skin is not well when it doesn't blanch. That's not good. So what can we do to create that perfect condition?
Try not to put weight on it. Put it on the opposite side, or help them with pillows, blankets, give support, turn a little bit. Depends on the area.
So use repositioning devices, as many pillows or wedges as we can. We probably more than likely going to turn them more than every 2 hours, every hour. And then on that part of that skin, we're going to cover that skin with that transparent film. And that creates that perfect condition. And if you can catch that skin before it actually opens, if you start turning that every hour, using those repositioning devices to make sure that we're relieving that pressure and cover that skin or that site with that transparent dressing, then they usually will heal less than 24 hours. That skin will be healed. And so, but if you can catch it in time, but once that opening gets on that skin, it is harder to actually to heal. Any questions about any of that information? We have, I think, 2 more topics, and it should take us right on to time. We're doing good. So if you have any questions, please speak. Please speak. So let's talk about abuse. So what would put someone at more risk for intimate partner homicide? So let's talk about what would put someone at risk, and then we'll end up with a top risk factor. So what would make someone at risk, put them at risk for intimate partner homicide? So they are at risk for the person that they're in a relationship with, that they're intimate with, for harming them. What are some
Maybe
things?
like mental disorders.
Mental disorders.
They are always angry.
Okay, mental disorders, always angry. Okay, what else?
People that like abuse alcohol and drugs.
Okay, substance users. Okay. Okay. What about access to guns? Is that a risk factor?
For a homicide? Yeah.
Okay. What about if that person has previously been physically abused? Is that a risk factor for intimate partner homicide?
Yes.
Okay. So we got our list. Now from that list, which one would be the top risk factor that would put a person at risk for intimate partner homicide?
The gun.
You have the gun. Anyone else? That the top risk factor.
Previous abuse.
Exactly. The previous abuse is going to be the top risk factor. Like we named all of those risk factors. All those having the gun, access to the gun, all of those things are risk factors. But that top risk factor is someone actually performing an act that's actually harmed someone. So yeah, that's going to be that top risk factor. Okay. So leading risk factors for suicide are depression and other mental disorders, and it also includes substance abuse disorders. So we tend to see that in suicide in those that have mental disorders, substance abuse. Because think about it, someone that's using substances, they're not thinking rationally. So that puts them at risk for making decisions that they would not make if, if that substance was not in their body systems. Okay. So, but the leading risk factor for suicide are depression and other mental disorders, and then substance abuse use, because you're not thinking clearly. It alters the things that we do. Okay. So typically, let's go back to someone that abuses others. What's something in their past that they probably have been involved with? Someone that currently abuses someone. What's something that
Like sexual assault when they were a child.
right? So people who become involved in violence typically have previous exposures to some form of violence. So they've had that previous exposure, and that previous exposure has them to think that that's the way that you manage conflict or whatever's not going on, that's not correct. So they have viewed it as a way to fix things or to manage things. So physical neglect refers to the failure to provide. What things do physical neglect refer to? So you all let's put them in the chat. List at least one thing that physical neglect refers to. It's a failure to provide what? What would you say? Let me see what you got. Okay, food, hygiene, shelter. Hygiene, no bathing. That's hygiene, care. Okay. What else? What else you got? So physical neglect refers to the failure to provide, like we said, food, clothing, shelter, hygiene, and necessary medical care. So if those well baby appointments, those preventative exams and things, that the adult or the parent or guardian, they're responsible for making sure that those babies go to those doctor's appointments. And now they have it where they have appointments on Saturdays, even Sundays now in some areas that's available, because they do know people, for the most part, people work Monday through Friday. So they're having these other options available so that the parent or guardian can provide that best care for their child. Okay. All right, let's see. What else haven't we covered? We've done infectious disease prevention and control. We talked about sexually transmitted diseases, HIV, tuberculosis. We talked about bioterrorism, complex illnesses. We talked about human abuse and violence, and being culturally competent. So, case management. Let's go back over that. So, case management is usually saved for those cases where the patients have multiple chronic diseases. And if you think about it, well, case manager, first of all, is time demanding. And so it's usually saved for those that have those complex cases, which meaning that they have more than one chronic disease process. If you think about it, they have to do the follow-up. They may need resources. They may need assistance with getting the medications that they need. And that's a lot for a layperson to be able to navigate through those different systems. So case management can be labor intensive. Time consuming. It can be costly. But because of advances in technology, our knowledge base, people are living longer, and therefore they're also having those complex problems. So those caseloads are, intense, and it does take a while to stay on the phone to figure out, well, this person has this insurance. Can we send them to the skilled nursing facility? Or if they go, how many days can they stay? Because it's not a one size fit all. is insurance based, because that insurance is paying for how they will stay there in the services that are provided. So case management plans, there it is individualized. We can't get away from providing that individualized care, and we don't want to get away from it, because even though the patient in 201, 202, and 203 might all have hypertension, they still may that one's a male, one's a female, one's an older adult, older female, one's a young. We still want to provide that individualized care. So even though case managers are safe for those complex cases, it's still individualized care. And it's even more so now based on all those different insurances that people have. And so it takes time to research and see, the resources that are there. An example of insurance. So for the most part, insurance is pays for those hearing tests that you need that done, and the appliance in the event that you fail the hearing test. But there are some insurances. So when you're out there shopping or you're talking to your patients about insurance, you want to make sure that that other piece is there. In the event it's okay, it's good that we can take the test and it's identified that I have a hearing, just not get a device. But there are some insurances out there that does not cover those devices, and hearing aids are really, really expensive. They're really expensive. So let's talk about collaborating, because I think these concepts we get them kind of mixed up. In collaborating, a person's attempt to work with others to find a solution, for both parties. That's in collaborating. Cooperation is the ability to understand and meet the needs of others. So there's like no trying to a middle place. It's just, okay, well, we'll just do whatever it is that you need done. That's cooperation. So, but collaborating, we are trying to, find a middle ground, a common and solutions for both parties. Okay. Are there any questions? Any questions? Just going by so fast. Let me look in the chat, make sure there aren't any questions. Mm-hmm. All right. So where is home health care provided at?
At home.
In the patient's home.
In the patient's home. It's provided that in the patient's home. So in order for us to be most effective, we have to establish that therapeutic relationship. That patient and those family members, they must trust us because we're going into their home. So it's really important that we, we're going to establish that therapeutic relationship anyways, but just remember that we're not just in the hospital, we're actually invading their private space. So it's going to be even more important. So you have to spend some time, talking to them and establishing that relationship before they'll open up. This is in the home setting, and before you can proceed with, why you are there. And for home health, we do want to teach our clients to be as independent as possible. Because remember, in the hospital setting, we're there 24/7. Someone's always there. But in the home, intermittent care is provided. So what that means is we're there on Monday, maybe from 10 a.m. to 11 a.m. We don't come back again, maybe until Wednesday. So that's intermittent. No one's there the entire time like it is in the hospital setting or the long-term care facility. So Medicare opened up for for people to be able to receive home health care, but there's a lot of documentation that is required. So the Omaha system is a system that is most relevant for home health nursing, because with that system, it has all the boxes. It has all the information that needs to be addressed in order for that client to qualify for that home health and to receive those services. Because if things are not documented, then that person, might not be eligible. More than likely, they're not going to be eligible for that home health care. So we're glad that they developed that system, because we don't have to remember anything. It's all there. So those electronic health records, they're based upon that Omaha system. So, how has technology influenced outcomes of patients? Or has it influenced outcomes, for patients?
Give easy access from any other facility or providers for
Okay.
the care for the patients.
Okay. And so, they came about, the healthcare, the insurance companies, they were, putting pressure on cost control, and they wanted these improved health outcomes. And we're spending all this money to provide care for someone, but then the health outcomes are, they're worse, or they're not as good. There's no increase or better results that are coming. So the telehealth, it has increased the outcomes, because it is streamlined. And just look at the electronic health record. I don't know if you all have administered medications yet in the clinical settings with a electronic medication administration record. If the medication is getting ready to be late, it turns a certain color. So those little things, those different, it may not seem that significant, but it alerts that nurse, like, hey, I need to go ahead and be giving this medicine, because otherwise I am administering medication out of the time frame. So the development and the increased use of technology, telehealth technology, has helped with health outcomes, and also the cost, cost control. Okay. And are there any questions? Are there any questions about anything that we have covered? So I wanted to yield the time to, because we don't, of course, we take our break in 10 minutes, because we're gonna, we always take it at the end. So the next couple of minutes, I'll be quiet and let me hear from you. Are there any questions about any one concept that we have talked about? Because we went back and we went over weeks, 6, 7, 8, 9? No, 7, 8, 9. Any questions? Okay. So if you have a question and we need to go to the breakout room, just let me know.